Good afternoon. I'm here today with a colleague actually who I met on the London Real course. He's a specialist in gut health, and he's got some really fascinating messages about your gut health that you need to hear from a medical perspective. And I'm really looking forward to this because I think it could join together the traditional medicine perspective and certainly the more modern approaches that I'm not capable of offering in my clinic. So without further ado, I would love to introduce Dr. Mo Rengan, and I'd like to ask him to introduce himself in his own words to the audience.
Well, thank you, Ed. Thanks for that nice introduction, and thanks for having me on today. I'm here actually in the hospital. I'm on call this week and just taking a little break from patient care to share with you some knowledge.
Great, and I think this is a really important message that from our perspective, and maybe you see this as well, people come in to the clinic and they have, there are so many people now with GI issues, IBS, irritable bowel, affects so many things thereafter, the concentration, their ability to socialize with other people in environments, that can affect their mental health. Really, there's nothing that this doesn't become all pervasive within somebody's lifestyle. So what, from your perspective, do you see time and time in the clinic that you wish you could get the message out to your patient base and wider that people are not hearing?
I think a lot of it is preventive health. Just take better care of yourself initially. If someone can get the word out to the patients that if you do X, Y, and Z, it can prevent a lot of the number of visits to the office. IBS is the second most common cause of missed work in the US. Wow. Only behind cold and flu-like symptoms.
Wow.
That's pretty astonishing. Missed work and disability because of IBS, and simple things that you could try in your daily lives. Caffeine is one that's often overlooked. It's a known precipitant of IBS symptoms. But we're in always such a rush and a chaotic state that we need to keep going, keep pushing. And how are we going to do that? We need caffeine. We need coffee and sodas and energy drinks, billion-dollar industry, Red Bull. I did a webinar last week, and I'm sitting there having a Red Bull. It was on my desk as I'm talking about how bad it is for you. I'm sitting there drinking one. So I'm guilty of it too. But caffeine's a big one. Other lifestyle measures, nicotine, just tobacco is a known irritant as well. So simple things in your daily lives that you often overlook. If you make some minor changes, you'll feel a lot better. Definitely.
Yeah, I think that's a really powerful message of actually exporting the responsibility. I'm quite harsh with my patients. I can be in the private sector, I suppose. And I will often say to people who do have preventable illnesses that I'm more than happy to help you, but actually the responsibility, the health responsibility comes back to you, the individual who's got these issues. And I'm more than happy to hold the handpiece out so that they can pull themselves up. But I need them to at least put in half the effort from their perspective. And sometimes people don't hear this in a genuinely altruistic, well-meaning sense. They get talked down to. And I think your advice there is brilliant, because actually highlights some really handleable things that you can do with the reduction of caffeine, the reduction certainly of nicotine. Would you say that people are receptive to that advice from your perspective?
They are. They yes and no. They acknowledge it. They understand it's a problem. But I'll hear, well, if I stop smoking, I'll gain 15 pounds. So
right.
what do you say to that? Or doc, I really can't go without my morning coffee or cup of coffee or pot. Sometimes I hear a pot or two a day, which is absurd, but I get it. And even at nighttime after dessert, they'll sneak in a little chocolate or two. Well, milk chocolate has a lot high caffeine content as well.
Absolutely. So. Yeah, because people don't realize that, do they? That certainly if you're having dark chocolate, which is supposed to be really good for you, and generally it is, it's also very highly concentrated with caffeine. What's your opinion of lactose and milk? Do you see a lot of lactose intolerance within your clinic?
I do, and again, there is a lot of overlap between the symptoms of lactose intolerance and celiac disease and IBS.
Oh, yes.
EPI, exocrine pancreatic insufficiency, another big one that's been marketed quite heavily in the US recently. That's part of my diagnostic workup. When you come to my office and you haven't been labeled IBS, you won't be until I exclude everything else that are common things, commonplace. And lactose intolerance is one. So really? I order a breath test right off the bat, and within hours you could tell if you have lactose intolerance or not.
Wow.
Celiac disease is another one, a gluten allergy or gluten sensitivity. That's where I recommend an endoscopy, where you put the camera in the mouth, look down into the small bowel, and take a duodenal biopsy. That's how you diagnose celiac. And in the US, it's very common. 1 in 150 to 200 patients will be diagnosed with celiac.
Wow. Okay, yeah, I think that's roughly similar over here. I'm not, within my clinic, I don't have access to endoscopy and similar diagnosis, but I would argue that the vast majority of people I see, an intolerance to wheat and gluten and perhaps lactose and sugar, and probably you've added caffeine to that list as well, which is great, is really the principal cause of the vast majority of issues that people have, whether they're not absorbing the correct nutrients, so they then become nutrient deficient and they can't achieve their objectives in their training perhaps at high level, or they feel that the nutrients they're intaking just aren't giving them the weight loss goals that they want. They feel they're eating the right things, but they're just not getting the help. Where do you see the next 10, 15 years of pharmaceutical help on this? Are you looking at getting people off of pharmaceutical help? What's your best advice in terms of ameliorating some of these symptoms for people?
Yeah, so that's a good question. Again, if we're just going to focus on irritable bowel, I rule out gallbladder disease as well. So I get an ultrasound and make sure the gallbladder is functioning normally, with me with a HIDA scan as well. I also do a colonoscopy, and I'll take biopsies of the colon, ruling out any sources of colitis. If they come in presenting with diarrhea, I'll order stool studies to make sure we're not overlooking a very treatable gut infection. Once they're all that's done, it's negative, then I say, okay, you most likely have irritable bowel. And how do I approach them? Again, a lot of it is education. That's where I start. A good history for me is key. So when you first come to my office and I'm establishing a relationship with you, I want to gain your confidence and trust that I'm someone who will listen, and you can trust me with some very confidential information that won't be shared anywhere else. And I started really doing a deep dive into what the relationships are like at home with their partners.
Really? Wow.
Relationships with kids, what's it like at work with your boss, your coworkers, and has there been any abuse in the past? That all plays a role and all ties into the manifestations that I see.
Wow, so that's really quite advanced stuff, isn't it, really? Because I'm beset in this country, in the UK, by people who have the most basic diagnostics, and nothing is given to them beyond that. So you've just named 4 or 5 aspects there of their psychological health, which, you know, in my sense, I would argue it probably to a degree precedes the irritation, and it's a cause in itself of the IBS. And I think that we need to get this message out to people, because without people being aware that if somebody is making your life really tough, then that stress factor is going to affect your body, and often in very specific ways. You know, I know people who've had a really bad shock in their life, they lost a partner, or they have a really terrible reaction to this every year on the year date there forwards of their trauma. And they often have gut issues as a result of that. So if you know that's coming down the track, because we can't alter the past, then you might say to people proactively, well, you'll reduce your caffeine intake, you'll significantly eliminate processed sugars from your life, and get people thinking ahead of the game. Have you tried any combination treatments with acupuncture or any holistic therapists?
Well, that goes into my what I've been preaching the last. I want to call it preaching, because that's what I've been doing.
Yeah.
But I wanted to back up a little bit. You were asking about pharmaceuticals. I'm not a huge fan of taking pills and prescribing pills. And if I do use them, I try to get patients weaned off them quickly, after 8 weeks, 12 weeks. I am not a fan of pharmaceuticals, and a lot of patients don't want to take pills. They want to try to find some natural approach. So to answer that question about pharmaceuticals, I'm not a fan. There is a lot of research between what goes on. It's called the brain-gut axis. And lots of research out there, hundreds of thousands of articles showing the connection, the signaling between the brain and the gut, why sometimes the gut's referred to as a second brain. Yeah. And it makes a lot of sense when you talk about neurotransmitters, serotonin, dopamine, norepinephrine, some of the more popular ones out there, well known. 90% of serotonin is made in the gut. 50% of dopamine is made in the gut. A lot of people don't even recognize that. So if you can modulate the transmission of those neurotransmitters, that would be a way of dealing with IBS symptoms. So part of our pharmaceutical approach to IBS patients is tricyclic antidepressants, SSRIs, common drugs like Prozac or Zoloft, that kind of thing. And they're used, they're effective, but carry some large amount of side effects.
Yeah, absolutely. I think that's important to mention, that some people who need these SSRIs temporarily, from my perspective, often, and again, this is what I've seen in the clinic over the last 6-7 years, they get left high and dry on these as their only means of controlling their pain, psychological pain, their physical issues. I know people with back pain who've also been prescribed SSRIs, and they get left on them for years. Coming off of that then is a real high mountain to climb for most people. So I'm always saying to people, have as many different ratchets on the mechanism from your own perspective. Your diet is a huge one that you've got massive initial primary control over. It's not difficult to do massage, and if you're doing massage, you'll improve your blood flow. It's not difficult in some respects to do acupuncture, you know, and I have lots of people who do really well with these holistic approaches, these traditional medicine approaches, in conjunction with the more modern conventional medicine approaches as well. And combining all these things together, having an integrated approach, is really vital, and people are not receiving this message. You've done a series, haven't you, about the GI issues that you've seen and the IBS potential as well. Do you want to tell people about that? Because I think people need to hear.
Yeah, so in my time as a gastroenterologist, I've been in practice over 15 years. But I started my training in med school in 1996. I give you that year because it was a very important year in the U.S. for a number of reasons, but that's when the Compassionate Use Act was enacted in California, making it the first state to legalize medical marijuana.
Wow.
So when you're saying about holistic approaches and natural, Yeah, I'm looking at other avenues because patients are quite frustrated with traditional medicine. The medications we have that we offer are effective at times, but carry way too many side effects, which then leads to non-compliance. The patients just don't want to take it. They want something else. Do I recommend acupuncture at times? Absolutely. I always say go seek a therapist, someone who can really talk to you. Because I'll counsel you in the office, but I don't have as much time to devote to it. So you're going to see a therapist. I recommend massage, like you said, acupuncture. But one that I've really been going down the path and seeing as a natural plant, cannabis, and how it's been working. And again, there's a lot of research out there now, which just exploded in the last 20 years or so. Things that we're not taught in med school. I would say 9 out of 10 physicians, if you polled them, they would never even heard of some of the stuff that I've been learning about, and which makes a lot of sense physiologically.
Yeah,
so if you want me to expand on that a little more, the endocannabinoid system plays a role in that brain-gut interaction. And what the endocannabinoid system is, it was first discovered in 1992. And it's almost like picturing your body as a boat in the ocean that's starting to tip. The endocannabinoid system kicks in and balances it out. And again, a lot of research has been done. It was discovered while they were looking at how THC worked in the body. And a scientist in Jerusalem injected a synthetic THC extract into a rat, and all the radio-labeled tracer will go right to the brain, which led to them to discover this cannabinoid receptor CB1. And there are now 2 cannabinoid receptors out there that are identified, which then started having scientists thinking, well, if there's a receptor in the body it's almost like a lock and key configuration, there has to be an intrinsic lock or key in the body. That's how they found those endogenous cannabinoids.
Wow.
And what makes even more sense is that the 2-AG, one of the well-studied endocannabinoids, was first isolated in the canine gut. So it just keeps going back to the gut.
Yeah.
It just keeps going back to the gut. So then they start realizing, well, that's how THC and CBD work, by supplementing those cannabinoids that are missing in the body, and may be responsible for the etiology and the pathophysiology of certain conditions like irritable bowel, fibromyalgia, migraine headaches, things that we don't really have a good handle on.
Yes, that is an amazing point. I mean, the idea of people actually thinking of the body as really requiring these, certainly THC and similar enzymes that the body must have, otherwise it's going to become significantly out of balance. I spoke to a lady yesterday who's been treated for months for leg pain, and she herself has taken it upon herself to have some CBD oil. Leg pain, back pain, gone. It's absolutely remarkable, and she's of quite an advanced age, if I can gently put that. And there's no reason why more people couldn't benefit massively from your input on this. So, what you've got a website and a 6-part series, is that right?
I do. My website is drmorengen.com, MORENGEN, and I'll describe more about cannabis and the cannabinoids and the effects on the GI tract, but not just the GI tract. The endocannabinoid system is involved in the immune system and the cardiovascular system, the urinary system, musculoskeletal. So a lot of other systems, but my primary focus is gut health. So when I look at trying to optimize gut health, you're talking diet, you're talking a perfect balance of probiotics, the microbiome, as we call it, and enhancing the bacteria in your gut, as well as a balance with the endocannabinoid system. And I think taking all those into play, there is a interaction and an interplay that if you can somehow satisfy all 3, you can develop optimal gut health.
Absolutely. And I've seen a pattern as well with people who've taken CBD oil who then become a lot more receptive to emotional therapy help as well, which I do a bit in the clinic. And when you can't help but not do a bit of this in connection with patients who you see regularly. And they suddenly start to shed issues from their life that have been a massive weight upon their shoulders. And I know people, like I say, who have had back pain, they've come for treatments for back pain, but the real issue is their gut health. And just getting this message out there that actually, if you look after your gut, the likelihood is that you'll then be able to extrapolate that out to other health systems, your brain particularly, your heart, like you said rightly, your immune system, what could be more important at the moment. And this message, for some reason, is not getting out there. So I'm certainly going to put your website underneath the video so people can find it and research into this, because they need to be in contact with people like yourself who can help them expand this net, so that they can catch all these symptoms together and go, hang on a minute, maybe my lack of concentration, maybe my sluggishness in the morning, maybe my leg pain, as we've seen, certainly gut pain and associated with that, maybe actually I don't need all these pharmaceuticals that I've been put on. Maybe I need a new approach based around health responsibility and integrated medicine, focusing on the diet and their mental health as well, things you can do at home. So that really fascinates me as far as this is concerned. Is there anything else you'd like to get out to the audience that people just don't hear?
Again, traditional medicine is not always the answer, and you need to find somebody who will listen and think outside the box to promote your health. So,
yeah, absolutely. Well, that's amazing. I think what we should do is maybe continue this conversation once we get some feedback and some questions from people back, and factor that into maybe another session if you want to do it in short bursts, maybe an FAQs type thing in a couple of weeks.
Absolutely.
Great, fantastic. Thank you very much for joining me today, and let's get out there and get this message to the people.